Hi, my name's Jessica Moore, and I would like to talk to you about abortion today. Melissa Dexter, the girl who killed her baby at prom, received 15 years in prison. Amy Grossberg, who along with her boyfriend killed their baby in a motel room, received 2.5 years. Both of them were sentenced because they killed their newborns, just minutes after they were delivered. Why is it such a crime to kill just minutes after the baby is born, but yet perfectly fine to so many people, just days before they are to be born? I'm not a doctor or anything, but I am a mother. I have a beautiful 3-year-old little girl, and I just found out I'm expecting. And I had a miscarriage before my daughter. And I was told that I had had an involuntary abortion. That was one of the hardest things I could ever hear. But to be nice, they put it in the term of a miscarriage. But now that I think about it and I'm expecting again, I couldn't take my baby's life. My baby's heartbeat is getting ready to begin. My baby is getting ready to sprout little arms and legs. And soon it'll be breathing on its own. Yes, it may not be a little person, but it's inside of me. This is the only person that can hear your heartbeat. Why do you want to take that away? Somebody took a chance on you, so why don't you take a chance on someone else? I just want to help people understand the decisions that they are going to make and put someone else through. Not only does it affect you long term, but you lose a little part of you. The abortion definition, according to dictionary.com, is the deliberate termination of a human pregnancy or any various surgical methods for terminating a pregnancy, especially during the first 6 months. The removal of an embryo or fetus from the uterus in order to end a pregnancy. How do you not consider that murder? Today, I would like to discuss with you some very important information about abortion and making the choice to stop your child, or your children's heartbeat. The main points today that I would like to discuss are the abortion statistics many people should know about. I would also like to discuss the statistics of who are actually having the abortions. The abortion methods used today, yes, they may be safer, but they're still not that healthy for you. And I would also like to talk about the physical risk and the emotional risk to the mother, as well as ways you can prevent the situation of being put into having an abortion. First of all, in 2007, the highest number of reported illegal induction abortions occurred in Florida. They had over 91,000 abortions. In 2008, there were approximately 1.2 million abortions took place in the U.S. In 2007, abortion ratios by state ranged from a low of 58 abortions per 1,000 live births in Idaho and South Dakota. Wyoming had too few abortions for reliable tabulation, to a high of 737 abortions per 1,000 live births in New York City. I just don't understand how you take someone's life. But now that we've looked at some of the statistics, let's look at who are actually having the abortions. In 2007, 87 of all abortions were performed by unmarried women. Women between the ages of 20 and 24 obtained 33% of all abortions. Women between 25 and 29 obtained 24%. 50% of U.S. women obtaining abortions are younger than 25. Women aged 20 to 24 obtained 33% of all U.S. abortions, and teenagers obtained 17%. In 2007, adolescents under 15 years old obtained 0.05% of the abortion rate. And the highest abortion rate of 768 abortions for every 1,000 live births, 47% of women who have had abortions had at least one previous abortion. So these women continue to abort the babies because they don't want to take responsibility. The abortions method used today, before 14 weeks, they use suction or aspiration. For this procedure, you lie on your back with your feet in stirrups, and the doctor applies a shot of anesthetic to your cervix to reduce pain. Your cervical muscles are stretched with cone-shaped rods until the opening is wide enough to allow abortion tools to pass into your uterus. Then the doctor guides the suction device through the cervix and into the uterus, which is when they officially pull the baby, limb by limb. They also use a D&C, a dilation and cauterization. The doctor opens the cervix, as described above, in the same case as the suction aspiration. But in this case, the abortion is done with a loop-shaped knife, which he scrapes the walls of your uterus. And the RU486, the abortion pill. This, you simply take this before the 9th week of your pregnancy to make your body abort your child. After 14 weeks, they use a D&E, a dilation and evacuation, because the bones of the fetus are likely to puncture your uterus. After 16 weeks, they use the saline, where this actually, they put a shot into your uterus, which causes it to burn your child's skin, and eventually sending you into labor. Some children are still born alive. The physical risk of abortion, not only do you run the risk of hemorrhage, infection, perforation, effects in later pregnancies, an abortion can cause you to never be able to have children again. In some cases, an abortion can actually kill you. Or you can actually continue with the pregnancy because the doctors were unable to end the pregnancy. Not only are there physical risks, but there are a ton of emotional risks that you go through. I know with my mother gave me life. I gave my daughter life. I lost a child, and I went through the grieving process. I dealt with the sadness, the long-term grief, the marriage problems, the anger, the guilt, the difficulty, the flashbacks, knowing that I should have still been pregnant. Every year that date comes by, you can't help but remember what could have been. Not only will having an abortion is a permanent decision, but it can change your life forever. You could possibly deal with the sadness for the rest of your life, knowing what you've done. Women who abort are seldom warned of the possibilities, the consequences, or serious violation of medical ethics. I don't understand why a doctor cannot sit down and explain to a woman what she could possibly go through, or why this is not ethical. First of all, to prevent abortion, why don't you use contraceptives? There's birth control, there's condoms, there's abstaining from intercourse. It's not that hard. If you do not want to take the responsibility of in the heat of the moment, then do not even put yourself in the situation of possibly having a child as an outcome. Because there are many people in this world who would love to have a child. I wouldn't give up this beautiful little girl for anything in the world. She means the world to me. Now that we've looked at the statistics, and everything else, please make the decision to just abstain from intercourse, or just don't do it. Just take a pill or use a condom. Because these little people, they're amazing. They are the most amazing little people you will ever meet in your entire life. They have their own personality. They're the only person that will ever hear your heartbeat from the inside. They're the only person that will ever love you unconditionally. So please make the decision to save a child's life. Thank you.